They told us routine checkups were the gold standard of prevention. But what if we told you that after 70, some of the most common medical tests might actually do more harm than good? Behind closed doors and buried in the footnotes of peer-reviewed journals, studies have quietly revealed that some health screenings, those that are often done out of habit, may trigger a chain of unnecessary anxiety, invasive follow-ups, and even irreversible damage in seniors. Most people don't know this. In fact, 99% of seniors over 70 are still undergoing tests that have been scientifically shown to offer no added benefit, and in some cases, increase mortality by as much as 20%. One of them increases your chance of complications by up to 35%, even when you're perfectly healthy. And the number one test in this list, it could land you in the ER by increasing your risk of lung collapse by over 25%, even if nothing is wrong with you. Now, to be clear, this video is not personal medical advice. These insights are for education only. Always talk with your doctor before making any screening decisions. But everything we will share here is based on real studies, real patient stories, and real risks you deserve to know. Before we dive in, let us know in the comments below. Have you or someone you love ever had a test that led to more stress than solutions? And what's the one test you feel really unsure about? We're reading and replying to every single comment with personalized tips and advice, so don't hold back. Now, without any further ado, let's start with number 5. Number 5. Carotid artery ultrasound. This test is often offered to seniors as part of a stroke prevention package. It uses ultrasound waves to look for narrowing or blockages in the carotid arteries, which are the blood vessels that carry blood from the heart to the brain. On paper, it sounds incredibly smart. After all, strokes are devastating, and early detection seems like the obvious path to prevention. But here's where it gets tricky. When this test is used routinely in people without symptoms, especially those over 70, it can become a problem. That's because the test often finds minor plaque buildup that is not causing any symptoms and is not dangerous. However, once something is found, the next step is usually aggressive intervention. This can include risky procedures like carotid artery surgery or stenting, which are operations that come with a high chance of complications. According to a large-scale study published in JAMA Internal Medicine in 2014, out of every 1,000 seniors who received a carotid ultrasound without symptoms, only 3 had a blockage severe enough to warrant surgery. But nearly 60 were referred for further testing or procedures that caused unnecessary stress, financial costs, and in several cases, stroke as a complication of the intervention itself. The U.S. Preventive Services Task Force, which is a leading group that evaluates screening tests, explicitly recommends against routine carotid ultrasound in asymptomatic people. The reason is simple. The risks of false positives and unnecessary follow-up far outweigh the chance of catching something serious in time. That said, there are specific situations where this test is very helpful. If someone has experienced symptoms like sudden weakness on one side, difficulty speaking, or vision changes, that is, signs of a transient ischemic attack or mini stroke, then a carotid ultrasound can be life-saving. In that case, it helps doctors plan treatment to prevent a major stroke. But for a 75-year-old man who simply wants a routine check, the test could open the door to more harm than good. I remember one patient named Elias, who was 76 and retired from a long career in plumbing. He was feeling great, but got the test during a community health fair. The scan showed moderate plaque, and the doctor rushed him into a stenting procedure. During recovery, Elias suffered a small stroke, which left him with speech slurring and weakness in his right arm, something that never would have happened if the test was avoided. Instead of routine ultrasound, the better path is lifestyle modification and blood pressure monitoring. Those reduce stroke risk more effectively than any scan. And when symptoms appear, that's when testing should be initiated, not before. Let's now move on to the next one. It may surprise many men. Number 4. Routine vitamin D testing. It sounds harmless, doesn't it? Just a simple blood test to check your vitamin D level. In recent years, vitamin D has been marketed as a miracle nutrient that supports bone health, immune function, and even brain performance. So testing for it seems like a no-brainer, especially in older adults who may not get enough sun. But here's the catch. For people over 70 who are not showing symptoms of deficiency, routine testing rarely changes anything. Worse, it often leads to oversupplementation, which brings its own serious health risks. According to a 2020 study published in the New England Journal of Medicine, more than 40% of seniors who tested low on vitamin D had no clinical signs of deficiency at all. And yet most of them were placed on high-dose supplements. What happened next was alarming. Among seniors taking over 4,000 international units daily, the risk of kidney stones increased by 23%, and rates of hypercalcemia, which is an overload of calcium in the blood that causes nausea, confusion, and even heart rhythm problems, jumped by 18%. The problem is that vitamin D levels vary depending on the season, the lab method, and even hydration status. That means someone could test low in January and normal in July, without doing anything differently. And these fluctuations are often misinterpreted, leading to a cascade of interventions that aren't necessary. Routine testing also doesn't predict fractures as clearly as once thought. A large 2019 meta-analysis published in The Lancet reviewed over 80 randomized trials and found that in seniors without symptoms or risk factors, vitamin D supplementation did not significantly reduce the risk of fractures or falls compared to placebo. But there are cases when testing is warranted. If someone has osteoporosis, a history of frequent falls, or specific signs like chronic muscle weakness or bone pain, then checking vitamin D makes sense. It helps guide targeted treatment. I'll never forget a woman named Samira, age 81, who came in feeling dizzy and tired all the time. Her doctor immediately ordered a vitamin D test, which showed a slight deficiency and prescribed megadoses. But a week later, she was hospitalized with nausea and confusion. Her calcium levels were dangerously high. It turned out her dizziness had nothing to do with vitamin D. It was a blood pressure medication side effect. The test created a distraction, not a solution. The better approach is to assume that seniors may benefit from a modest daily dose, around 800 international units to 1,000 international units, without needing blood tests unless symptoms arise. This way, you avoid the trap of overtreatment while still supporting bone health. Now get ready, because number 3 is one of the most debated and misunderstood tests for older men. Number 3, prostate-specific antigen for men over 70. The PSA test is one of the most controversial screenings in modern medicine. It measures the level of a protein in the blood that is produced by the prostate gland, which is a walnut-sized organ that sits just below the bladder in men. Elevated PSA levels can sometimes indicate prostate cancer, but what most people don't realize is that high PSA can also result from benign conditions like prostatitis, which is inflammation of the prostate, or benign prostatic hyperplasia, which is an age-related enlargement of the gland. For men over 70, the test requires even more consideration and weighing of the pros and cons. That's because prostate cancer in older men over 70 often grows so slowly that it probably doesn't cause symptoms, and usually doesn't spread or shorten life. But once the PSA test number is high, biopsies usually follow, which are painful and carry risks like infection and bleeding for older adults. Even worse, when prostate cancer is found, in some situations it is a slow-growing type that would never have caused harm. However, some patients are directed to aggressive treatments like surgery or radiation. These treatments can sometimes cause some long-term side effects like incontinence, which is the inability to control urination, and erectile dysfunction, which is the inability to maintain an erection. In fact, a pivotal study published in the New England Journal of Medicine in 2012 followed over 180,000 men for 11 years. It found that routine PSA screening did not significantly reduce prostate cancer deaths in men over 70. In fact, it led to a 50% higher chance of being diagnosed with a cancer that never needed to be found, and a 30% higher chance of undergoing treatment that reduced quality of life without extending it. The U.S. Preventive Services Task Force currently recommends against PSA screening in men over 70. That's not because they want to ignore cancer, but because the harms of unnecessary diagnosis outweigh the benefits. If an older man develops symptoms like difficulty urinating, blood in the urine or unexplained bone pain, then testing makes sense. At that point, the test is part of a diagnostic process, not a fishing expedition. One case study I saw in clinic reports was Ibrahim. He was 74 and used to run a small bakery. He felt completely fine but decided to get his PSA tested after a friend was diagnosed with cancer. His result came back slightly elevated, so he was sent for a biopsy. The biopsy led to a diagnosis of low-risk prostate cancer, and doctors rushed him into surgery. After the operation, he lost bladder control and struggled with depression. 5 years later, his cancer still hadn't progressed and probably never would have. Instead of routine testing, older men specifically can be guided by symptoms and risk factors. You'll want to pay close attention now, because number 2 is a test that seems completely harmless but may cause the most silent damage of all. Number 2. Routine electrocardiograms. The EKG is one of the most common heart tests performed in the world. It uses small electrodes attached to the skin to measure the electrical signals of the heart. The entire procedure takes less than 10 minutes and is completely painless. Because it's so easy to do, many doctors include it as part of a standard checkup, especially for seniors. But here's the truth most people never hear. When used as a routine test in someone without symptoms, especially over age 70, an EKG can become the start of a very dangerous path. That's because even tiny, harmless changes in heart rhythm or structure can appear on the results, especially in older hearts that have naturally aged. These minor blips are often labeled as abnormal, which triggers a snowball effect. Suddenly, you're sent for stress tests, echocardiograms, or even invasive angiograms, which are procedures that involve threading a tube into your heart through an artery. A massive study published in JAMA Internal Medicine in 2018 looked at 16,000 seniors who had routine EKGs without symptoms. Within 6 months, over 10% of them underwent additional testing. And more than 1 in 50 ended up having a heart catheterization procedure that turned out to be completely unnecessary. Worse still, those who had invasive procedures had a 12% higher chance of being hospitalized with complications. The heart changes seen on EKGs in seniors are often due to age-related tissue stiffness or medication side effects, not disease. When someone has chest pain, shortness of breath, or palpitations, an EKG is absolutely necessary. But doing it just to check a box can lead to surgeries that are needed. There's a patient I remember vividly. Her name was Layla, age 79, a retired English teacher who loved gardening. During a routine checkup, her doctor suggested an EKG. She had no symptoms, felt strong, and walked every morning. The EKG showed something called nonspecific ST changes, which is a vague term often found in older patients. Her doctor grew concerned and ordered a treadmill stress test. When that came back inconclusive, she was sent for a heart catheterization. That procedure caused a complication that led to a brief heart attack, and she spent 2 weeks in the hospital. All of it could have been avoided. The smarter approach is to only perform EKGs in seniors who are experiencing real symptoms, or who are starting a new medication that might affect the heart. For general screening, focusing on blood pressure, cholesterol, and lifestyle provides much better predictive power. This leads us to number 1, the most unnecessary and potentially harmful test for people over 70, and yet it's still included in so many annual exams. Number 1. Routine chest x-rays. It's quick, it's painless, and for decades it was considered a staple of the annual physical. The routine chest x-ray is often offered to seniors during checkups, pre-surgery evaluations, or as part of a screening bundle, with the belief that it can catch early signs of lung problems or heart disease. But when it's done without specific symptoms or suspicion of disease, this test becomes not just useless, but dangerous. Here's the shocking truth. Routine chest x-rays in asymptomatic people over 70 have one of the highest false positive rates among all imaging tests. That means the scan often picks up harmless findings like old scarring, tiny nodules, or age-related changes in the lung tissue. But because a shadow on an x-ray looks ominous, even when it's not, doctors usually feel obligated to investigate further. What happens next can be a nightmare. That blurry spot turns into a CT scan. Then, maybe a PET scan. Then possibly a lung biopsy, which is a procedure that involves inserting a needle into the lung through the chest wall to collect tissue. For seniors, this can be extremely risky. Lung biopsies carry a significant chance of complications, including collapsed lung and infection. And according to a 2021 study in Annals of Internal Medicine, more than 35% of people over 70 who underwent lung biopsies for incidental X-ray findings experienced a complication. Many of them required hospitalization or emergency interventions. Even more disturbing, over 85% of those biopsies revealed benign findings that required no treatment at all. The U.S. Preventive Services Task Force does not recommend routine chest X-rays for cancer screening or as part of general health exams. In fact, lung cancer screening is only recommended in very specific high-risk individuals, such as those with a heavy smoking history, and even then with a low-dose CT scan, not an X-ray. One patient who drives this point home was Mr. Gurgis, an 80-year-old retired bank manager who had never smoked, never had a cough, and was in great shape for his age. During a pre-op check for a hernia surgery, the hospital ordered a routine chest X-ray. It showed a small opacity in the upper lobe. Doctors panicked. They ordered more scans. A CT confirmed a tiny nodule. Even though it looked benign, the pulmonologist recommended a biopsy just to be safe. During the biopsy, his lung partially collapsed. He was hospitalized for 4 days with a chest tube. The nodule turned out to be an old healed granuloma from a childhood infection. It had no relevance to his health, and it nearly killed him. Routine chest X-rays offer no benefits in the absence of symptoms like chronic cough, shortness of breath, or unexplained chest pain. In those cases, they can provide vital clues and guide treatment, but using them as a fishing expedition in healthy seniors is not only unnecessary, it's dangerous. If the goal is to evaluate heart or lung function in an elderly person preparing for surgery, there are safer alternatives. A thorough clinical exam, a review of symptoms, and functional tests like walking assessments provide far more relevant data than a black and white image full of meaningless shadows. When it comes to detecting early disease, the answer isn't more radiation, it's smarter medicine. There you have it, 5 more tests that can do more harm than good if done routinely after age 70. Now you're probably wondering, what tests should I actually do after 70? Well, don't worry. We're working on a follow-up video revealing the 5 most important checkups every senior should never skip, so make sure you're subscribed with the bell on so you don't miss it. At the end, it's not that these 5 tests are inherently evil or shouldn't be used. They can be life-saving in the right situations. But the key is context. Testing without symptoms or clear indications opens the door to false alarms, dangerous procedures, and a healthcare journey filled with stress instead of support. Modern medicine has made incredible progress. But with that progress has come a flood of unnecessary testing, especially in older adults who are more vulnerable to the domino effect of one small finding, leading to a chain of dangerous decisions. It's a system built on fear, routine, and sometimes outdated thinking. But you have the power to ask smarter questions. You have the right to say, why are we doing this test? You can ask, will this change anything about my care? And if the answer is no, you can confidently walk away without fear. One of the most empowering things a senior can do is understand when testing helps and when it hurts, because informed choices lead to better outcomes, better quality of life, and more years lived in strength and peace. Now, we want to hear from you. Have you ever had a medical test that led to more stress than answers? And do you feel confident in knowing which tests are truly necessary? Drop your story in the comments. We're reading and replying to everyone. And make sure to share the video with a loved one who might be unknowingly walking into medical traps they don't need. Thanks for watching.